Hey everyone, my name is Russell Vo and I'm a PGY2 internal medicine resident from Texas Health in Fort Worth, Texas. I'm presenting to you guys today my quality improvement project titled Assessing the Change in Knowledge, Attitude, and Behavior in Medical Residents Through the Use of Point-of-Care Ultrasound Workshop, a pre- and post-intervention study. So, a quick overview. Point-of-care ultrasound, also known as POCUS, is an essential diagnostic tool in medical practice. It's not a stranger to us that the use of point-of-care ultrasound increases with each and every day. Our study is a quality improvement study that employs a quasi-experimental design that focuses on the impact of point-of-care ultrasound workshops, or POCUS workshops, on medical residents' knowledge, attitude, and behavior regarding lung ultrasound. So, moving onward to the methods section. The population studied in our experiment included 13 individuals, comprised of PGY1 and PGY2 internal medicine residents from Texas Health Harris Methodist Hospital in Fort Worth, Texas. Furthermore, the intervention at play included a 4-hour point-of-care ultrasound workshop composed of a didactic session and a hands-on practice session with standardized patients. It is important to note that our didactic session was derived from the Blue protocol, of which is described below. Furthermore, in terms of evaluation, the POCUS image quality or POCUS IQ scale was administered, along with a pre- and post-workshop Likert scale survey. And the overall outcomes focused on the residents' knowledge, attitudes, and skills regarding lung ultrasound. So, moving onward to the results section, I want to draw attention to both figures 1 and figures 2. The takeaway from these figures is that there was an increase in the self-reported scores from the Likert scale surveys when comparing the post-intervention group to the pre-intervention group. Furthermore, looking at these figures, the range in the scores were smaller in the post-intervention group when compared to the pre-intervention group, all of which indicates increased comfortability, confidence, and understanding regarding lung point-of-care ultrasound. Furthermore, analysis was done using the Wilcoxon-signed rank test, indicating a significant difference for the majority of the questions administered in the Likert scale survey. So, in conclusion, or in summary, our study found that the use of point-of-care ultrasound workshop allowed for significant improvement in the self-perceived knowledge, attitude, and behavior of medical residents regarding lung ultrasound. We do note that there are certain limitations in our study, including sample size and the fact that it was conducted at a single institution. That said, the implications from our study contribute valuable insights to point-of-care ultrasound education, all of which presents a pathway for tailored curricula development and underscoring the constructive role of standardized patients. The primary takeaway that we want to provide from our study is that the implementation of point-of-care ultrasound workshops, including didactics and standardized patients, as in our study, can be instrumental in enhancing providers' competence and confidence in lung ultrasound, all of which steers the advancement of medical education. I thank you guys very much and have a great day.